So I can also read this question with you. So this is a 62-year-old with hypertension and hyperlipidemia. So hypertension, hyperlipidemia, 62-year-old. I already saw three risk factors, you know, for cardiovascular disease. So develops crushing substernal chest pain at rest, lasting 25 minutes, resolving with nitroglycerin. Okay, so if it resolved with nitroglycerin, I know this is not a permanent blockade or something like that. So ECG shows transient ST depression during pain. And then we, of course, if you are, tackling this patient, if you are treating this patient, you want to do an angio. So angiography, it shows 75% fixed stenosis in LAD. So LAD, as you know, is the left anterior descending artery. And it says 75% fixed stenosis. So this question actually became a very easy direct question because it gave us a lot of information if you know how to interpret this. So the first thing that that caught my attention was the 62-year-old. Age is a risk factor. Hypertension is another risk factor. Hyperlipidemia is another one, right? And this person is having chest pain, and EKG is showing some changes. And you told us this is because of fixed stenosis, 70%, 75% fixed stenosis in one of the big arteries of the heart, right? And then they go on to ask us what is the most likely pathogenesis underlying his symptoms. So option A says reversible subendocardial ischemia due to fixed atherosclerotic plaque. This is already given to us in the question. I told you this became a very easy question. Option B says transient coronary artery vasospasm without atherosclerosis. Option C says plaque rupture with complete vessel occlusion, fibrinous pericarditis, microvascular thrombosis with embolization. So angio has already told us that this is a fixed stenosis and this patient is likely having angina, right? So like if you can figure out that it's the stable angina, okay, that resolves with nitroglycerin and on rest, right? So the correct answer is, of course, stable angina, and which of the options very clearly explains stable angina. So option A, which is reversible subendocardial ischemia due to fixed atherosclerotic plaque. Okay, so it's a fixed plaque, fixed stenosis, or it's 75% in LAD. Okay, so all of that information was already given to us in this question. Okay, option B was vasospasm, Prinzmetal. Okay, option C was plaque rupture, which has not happened here. Okay, how do I know it's not plaque rupture? Because it resolved with nitroglycerin. And second thing, angio is giving us this information, and ST changes have just started like going into an ST depression. Okay, so pericarditis happens after MI or due to other causes and infections. We can talk about that today also. And microvascular thrombosis. So microvascular thrombosis would be thrombosis in these blood vessels. I mean, if it is thrombosis, it would lead to ischemia and infarction, but not very classical angina. Okay.